Welcome everyone to the first session, session 1 of the Health Advocate X conference. I'm Robin Shapiro, I'm your host, and we'll be presenting for the next 50 minutes or so. Please feel free to put your questions in the chat and we'll be answering them at the end of this presentation. So this is the dynamic field of health advocacy, and during the next few minutes, we're going to be talking about what has contributed to making this field even more dynamic than last year. So let's get started. So here's the little roadmap of what we're going to be covering today. First, we're going to be checking in with attendees to see where everybody is attending the conference from. Then we're going to be looking at our session objectives. We're going to also take a look at the healthcare megatrends that are impacting this industry and implications for advocates. And then we'll also do what we always do every year, which is look at organizations and what's changing and who's supporting advocates in general. Okay, so before we start, and if you attended the kickoff, you know exactly what to do. Go ahead and go into the Annotate section and please put a stamp where you're from. I see Nancy and Melina, Melissa. Look at that. Jerry Lynn from Chicago. Tanya, how cool. Look at everybody from all over the country. And thank you, Lisa, in the Midwest. That's so fun. So fun to see all of you. And hopefully we'll be able to see you in person before too long. Okay. That's fun. You did it. You did it. That's great. All right. So, do you want to clear all the stamps off, Ash? It's kind of fun to see them on the objectives, right? So, here's what we're going to do. Here's what the session is set up to do. We are going to identify the major national organizations, their roles, opportunities to support advocates and patients. We'll learn the history and current status of credentialing for health and patient advocates through the PACB. And 3, we'll determine how to find advocates. And this is really something very important that everybody should know how to do. But before we do that, this year I added a section on healthcare megatrends, and one of the reasons why we did this in prepping with PACB and Melissa Cardine and Daniel Marshall, who you'll hear in session 2, we were thinking about all the changes that not only the pandemic has brought, but also just what is happening in the larger world. So we're going to focus on the 4 megatrends influencing health advocacy. And those 4 areas are, number 1, baby boomers, 2, this idea of healthcare for all, 3, telehealth, and 4, artificial intelligence. So we all know about the silver tsunami arriving and basically occurring right now. So we're going to take a look first at the data in terms of the 65 plus people are retiring sooner due to the pandemic. A lot of people have decided to retire, and the fact that they might not return to work. A lot of people are feeling differently since the pandemic. There's also an increased desire to age at home. So, and maybe this is brought on right by somebody's writing all over the slide. Stop the annotation. Stop the insanity. And I can see who's doing it too. So honestly, let's get into the presentation. Okay. So there's an increased desire to age at home. 45% have no retirement savings, which is just a startling statistic. And by 2030, 1 in 5 Americans will be retirement age of 65 plus. So we're all really going to be impacted by the fact that our country is aging. So the implications for advocates is number one, there will be fewer dollars out there, but greater needs. And so how will advocates address that? Number three, as this baby boomer generation ages, there will be more hiring of advisors and services to help people age in place. And three, there will be increased remote monitoring and increased in technology. So in terms of what that means for you in helping your family, friends, clients navigate healthcare, we will increasingly, advocates will really need to bone up on the technology. So the second megatrend, and much of this information comes from the Kaiser Family Foundation, is that COVID-19 pandemic has exacerbated underlying disparities in health and healthcare and really has increased the importance of addressing them. We're going to hear tomorrow from Dr. Nwando Anyanku, who will be talking about health equity for all. She's the Chief Health Equity Officer at Swedish Health Services. We just did tech prep with her this morning. She's amazing. We also know that American Indian and American Alaskan, Black, Hispanic people have experienced disproportionate rates of illness and death due to COVID-19, and that by 2050, so this is really not that far in the future, more than 50% of our population will be people of color. So it's increasingly important to make sure that we have and are addressing healthcare for all. So the implications for advocates is that there are more opportunities for you to identify disparities and watching out for those things, pointing them out, and advocating for people that you work with. It's more important than ever that advocacy skills are applied for better outcomes. And we know that when you're sick, not feeling well, you might not be in the best position to advocate for yourself. So the advocate is even more important. And three, there's a need to understand disparities and how to go beyond health and answer some of those very important questions in order to help clients and family members. So the third, I just noticed there's a typo on this slide. The third megatrend is actually telehealth. And we're going to be hearing from Icopa, who has a great presentation in the Anytime sessions that focuses on how advocates are helping with triage in telehealth. So the data is more patients are open to telehealth than ever before. Doctors can now navigate telehealth, and the pandemic has certainly increased the opportunity to get reimbursed for that. And so more doctors and providers are offering this and are more comfortable. That's been a huge barrier for a very long time. So the implications for advocates is the ability to participate from afar. And actually in tomorrow's Let's Chat happy hour, there's a specific table to talk about that. So if you're interested in that topic, when you go to the networking tomorrow, remember to pre-register for that. That will be a topic to talk about. Number two, there's a need to manage technology better. So if you are not currently up to date on your technology and how to plug in multiple calls, include multiple family members, either through video or through phone, this is your time really to boost your knowledge and skills around that. And actually, we're going to hear tomorrow from Dr. Jane Dunham in the session 6, The Changing Tides of Primary Care, about what some common myths are for telehealth. And so you'll want to make sure and listen to that. And the third bullet, again, is where the advocate can make a huge impact on triaging to telehealth. So that advocate translating, what is the patient experiencing and how does that maybe relate to whether or not telehealth is appropriate or not, or explaining to the patient, the participant, why telehealth may or may not be appropriate for whatever they have going on. So this is something that might not be on a lot of people's radar screens, but the future will include artificial intelligence in spades. And when I was putting this talk together, I was really surprised to see how much investment and how many startups are really targeted towards artificial intelligence and healthcare. It was really, really stunning. So what's driving this? So the data is financial pressures require more effective deployment of resources. And so that means that humans, if you don't have to have a human doing certain things, you're going to try to figure out a way that artificial intelligence can substitute here. Huge investment in artificial intelligence solutions to assist with everything from appointment setting to surgery. It's really a fascinating field, and you can bet that I'm going to be doing more research in this area. I'm really fascinated by it. So what are the implications for advocates? Well, advocates must understand how to work with artificial intelligence and also insert the human decision making. So that's what advocates are really great at doing, is kind of cutting through the clutter and making sure that if something is not working, certain systems are not working, that you make sure that the person that you're working with is being heard. Also, navigating technology adeptly, we just talked about this, will be ever changing. And so you need to keep up on your skills. And one of those areas is just to understand how to get through the artificial intelligence bots that might be screening for certain symptoms and things like that. So I would imagine that we will be having more sessions on healthcare and artificial intelligence and navigating that in the future. So those are some of the mega trends to look at. Okay, so the next section of this presentation is all about what is typically done, which is the organizations that support advocates. And we reached out to the following organizations, and here's what we asked. We said, we want to understand from your perspective what's been going on with your organization, history, mission, vision, structure, and key people to make sure that participants at this conference understand what's happening and who to talk to, what your programs, activities, and benefits are for many of these organizations or member organizations, and any data that gives us insight into this very dynamic field. And so what I'm about to share with you is what those organizations shared with me. So first is Aging Life Care Association, and some of you are more familiar with ALCA than others, but obviously with all the megatrends of aging, ALCA is a very important place for advocates to know about and also monitor, both for learning, education, referrals, all that kind of stuff. So if you haven't checked them out, their vision is to inspire excellence and setting the highest standards of the field within aging life care. And they are a community, the leading community of aging life care professionals. And their mission is unique knowledge-based continuing education, professional development, and the highest ethical standards. They're based out of Arizona and also have an office in Washington, D.C. And Tawny Hamill is the CEO there, and she is attending the conference, so I would encourage you to reach out to her. There she is. There's her picture. And the 2021 Board of Directors. And one of the interesting things also about this organization is it has very active chapters, which you see up on the screen there. So check out, where they are. I would encourage you to contact and reach out to Tani and try to suss out for yourself if there's some opportunities for you to take advantage of some of their great education opportunities. So here's a history of ALCA, and it started several decades ago, and they previously were the Geriatric Care Managers Organization, and you can see right there kind of what the progression has been of their history. But they have credentialing, and they have different levels of membership, which is important to note. And one of the things that we'll be looking for as well is they have a conference coming up in April that you should know about as well. So Ash, can you clear the annotation? There we go. So anyway, so here are some of the benefits and different opportunities that people have when they're a member of ALCA. And they've been at this for 40 years. So we can learn a lot from them. And again, really encourage you to reach out to Tani and the other ALCA members who are participating in the conference. So I'm not able to advance slides.
I think we're all patient and forgiving.
Hang on.
For sure.
There we go. Okay, this is about their conference at the beginning of April next year. And on the right-hand side, ALCA's 8 knowledge areas. And what I think is so interesting about this is they've had advocacy as part of their whole portfolio of what they do. And, in talking to leaders, there's a greater and greater opportunity to cross-refer between advocates, patient advocates, and aging life care professionals. Okay, so I'd next like to introduce the Greater National Advocates, and they are our presenting sponsor. We're very grateful to Brad Schwartz and all of his efforts. Many of you may remember Brad Schwartz's story, and we'll hear from him tomorrow, actually, in the opening session. But Brad was a victim of severe medical error that led him to lose his limbs. And he experienced sepsis. I'll tell you a little bit more about his story tomorrow. But that experience and also his background as a lawyer really led him to get very involved in creating awareness and making sure that the public understands what advocates can do, because he feels that if an advocate had been with him, he would have had a different outcome. Significantly different impact. So what he's done is he's created an organization called gnanow.org, and it is a national free directory for patients and loved ones who need help. And so everyone at this conference should be part of this directory. He's built it to be easy to find advocates. There is vetting and some standards in order to join the directory. So go to gna.org and sign up. And Brad obviously is at the conference. I think he has 3 meetup sessions. So make sure that you stop by there and get to know him and what the benefits of being part of this directory are. Really, overall, what his mission is to, and he says this, to wake up the nation to the life-saving benefits of advocates. And so he continues to raise awareness And we really appreciate being able to partner with him in raising awareness about the importance of advocates and advocacy. So again, thanks, Brad. I'm turning to the chair here because he's going to be sitting next to me tomorrow. The next organization is the Alliance of Professional Health Advocates. And you might know them from Advo Connection Directory, which has been going since 2009. Practice Up, which is online courses that you can take, and AFA Academy. So Tricia Torri, who is the founder of AFA, actually is attending the conference too. So I would suggest that you find her and say hello. She's really been a stalwart in this field, and since 2009. So she says, 13th year for AFA, and the focus is on business of advocacy, starting growing a successful advocacy practice. Their membership has increased 7% over 2020 with 289 topics discussed. There's very robust discussion, active community, 14 expert calls, and the AFA Academy, and impressively 85,000 searches in the directory. So people finding advocates, searching for advocates and finding advocates, which we all want. And if you're a part of AFA, you may have heard that My Care Alliance, that is headed by Ginger Jones, purchased AFA just last month, a couple weeks ago. So that is big news, and we're going to talk about what My Care Alliance is. Ginger Jones is the CEO of My Care Alliance, and she's also attending the conference, and strongly recommend that you reach out to her and stop by both the AFA and the My Care Alliance booth. So who is My Care Alliance? Some of you might know them. It was really interesting in talking to Ginger about the history of My Care Alliance. These organizations on the screen that are successful organizations in the areas of care management, senior care, adult daycare, advocacy. We're working together. These are the founders, actually, the co-founders of My Care Alliance, but they're also the CEOs or heads of these organizations. And they knew about each other. They successfully, were running their businesses in their own silos, but they knew of one another. And so they decided that they wanted to collaborate. And so they started informally collaborating in 2006. And what's interesting is all of those organizations combined reached 100,000 people. So they have really, really nice scale. And what they found was that working together could scale their businesses better. And so in 2019, they co-founded My Care Alliance, and very quickly started to launch a sales channel to advocacy organizations. They launched a membership last year in June. They currently have 107 members. And they then launched sales support to home care, adult daycare, assisted living, and personal care facilities in February of this year. And then they purchased AFA in October of 2021. So pretty cool that they're doing all of this. And I think the bottom line is they're trying to help advocates and advocacy services and those companies that can support patients and family members to scale and leverage and focus on what they're good at doing while providing back-end support. So member benefits are things like vetted technology solutions. And in fact, Ginger Jones will be giving a session on Saturday that I hope you all attend on scaling your business. And then she's doing a follow-up session on November 16th. And in the session area of the HUVA conference, go ahead and click on the link that allows you to schedule that session with her on November 16th live. So I suggest you do that, make a mental note of that. But you can also catch her at the conference. So they also, My Care Alliance also creates buying power. So as an alliance to get like bulk discounts and things like that on services and products that members couldn't get on their own. They've created an access to a library of resources that would be of interest to you, I'm sure, including webinars, training, and critical business information. And then they provide individualized coaching and advisory services. And right now, they're focusing on providing their services to advocacy, adult daycare, care management, home care, and facilities or group homes. What I think is really interesting about this group as well is they're going to, let's say, different scalable opportunities where advocates could make a difference in their geographic locations. So for instance, if they want to be working, and they are working with certain large employer groups, by joining that alliance, you're basically joining that group to be able to get business through that alliance. So definitely follow up with Ginger and ask her for more information on how to join the alliance and what the benefits are. All right. So the next organization is the National Association of Healthcare Advocacy. And they are sponsoring our Let's Chat networking tomorrow afternoon that you need to pre-register for through Zoom by going on the HUVA app. So founded in 2009, Knack has built the foundation for growth in the health advocacy profession. They led the Code of Ethics, Standards and Best Practices, and their board of directors consists of professionals with expertise both inside and outside the advocacy profession. In 2021, Knack has introduced a mentoring program, a Designing Your Own Practice workshop, Knack's regional groups, and they are participating and leading in a Code of Ethics revision in association with us, Health Advocate X, and the Patient Advocate Certification Board. So hear about that. In 2022, they are planning a website redesign, national networking events to engage all advocates, some seminars, and more webinars and even more. So highly recommend that you seek out the folks through the Let's Chat networking event. And that's where that is. So we'll see you there. That'll be super fun. Lots of interesting topics there. All right. So next we're moving on to the progress on certification and the Patient Advocate Certification Board. And the big news here is there are nearly 1,000 board certified patient advocates to date, which is really incredible. That's a huge milestone for the industry and the profession. So in last year, major projects and achievements, you probably have heard about the Job Task Analysis Study. Huge, huge effort. It was originally initiated in 2019. You'll hear a little bit more about that in session 2, the next session. And you see that Melissa Cardine and Heidi Coomer are leading this organization with Danielle Marshall as executive director. So anyway, the job task analysis study was initiated in 2019, and it serves as the first formal job analysis study of individuals working in this field, and it was a lot of work to have, and I think there will be emerging data. We're going to look at a few pieces of data in just a moment here. They also established eligibility criteria to sit for the exam. So you definitely want to look on their website and know that there's a minimum educational standard, which is very important. They also have implemented a recertification process for the first two exam cohorts from 2018, because that's when the test started. And it's so amazing, I think, that there's been this progress in this period of time. So super cool. You'll definitely want to connect with Danielle and Melissa and Heidi during the conference. So they also are participating and leading in this collaborative ethics task force project. And I'm very proud that Beth Droppert, who's the vice chair of Health Advocate X, is representing us on that. And you can definitely connect with her at the conference if you want to learn more. All right, so this is PACB's strategic framework from now through 2024, and there's a lot to chew on here. So the vision is board certification for all patient and health advocates. And the core mission is to promote the standard of excellence in patient advocacy through credentialing and standard setting. That's really essential for this field. So their three platforms are awareness, diversity, equity, and inclusion, and being evidence-based. So let's take the first platform, which is awareness. So they want to advance knowledge and acceptance of patient advocacy as a recognized profession. Increase the knowledge and recognition and value of the board certified patient advocate designation, the BCPA. Establish a mutually beneficial partnership with government agencies, professional organizations, and other stakeholder groups. So the second platform is increase diversity, equity, and inclusion amongst board-certified patient advocates and PACB. And again, I think this relates to the megatrend of health equity for all. We really need to be broadening out both who is being served and who is doing the serving in this area. Number two is to determine a protocol for addressing the needs of the military community of patient advocates. A huge, I mean, as the mother of a serving military person, very interested and appreciative that this is part of their platform. Number three, expand and reach the BCPA credentialing program. So making sure that we're paying particular attention to international and marginalized populations. And four, establish a scholarship program. So that's the second platform. So the third platform is being evidence-based. So continuous quality improvement through regular assessment of psychometrics underlying the BCPA exam. Two is to conduct a job task analysis to support an ongoing exam development. And three is to publish findings from the JTA study and utilize this data to develop a competency framework and model leading to the development of a body of knowledge for the profession of patient advocacy. It's really hard, right, to build the profession without any data. And so again, kudos to PACB for really a significant amount of progress in the last couple of years. So let's take a look at some of the data that PACB has provided, and looking forward to additional data to come. But the age range of the job task analysis study is that we're still trending towards over 50, so to the older side of things. 75% of respondents were over age 50. And so the population of patient advocates is aging and points to the need for more collaboration in education and training to ensure an adequate future workforce. And we've seen this coming, and it continues to be an issue, and that's the data on the side there. So the job task analysis force also asked the question, how much work-related experience should be required to prepare an individual to perform the role of patient and healthcare advocate? 82% of the respondents believe individuals need at least 1 to 2 years of experience to perform the role of patient and healthcare advocate. So, and obviously, you know, when you take a look at the data on the screen, we see kind of maybe an average of 2 years, with the 1 to 4 being the bulk of what people are suggesting. Oh. Okay. And so the last piece of data that we have to share with you on behalf of PACB is, what level of education do you believe is required to perform the job of patient and healthcare advocate? And it was overwhelmingly, everybody agrees that a minimum of a bachelor's degree is required. And so that's very consistent with where the organization has been moving in terms of minimum requirements, which is great. So thanks, PACB, for sending all that data, and good progress. So one of the areas we wanted to include this year that also speaks to the dynamic field and changing field of health advocacy is a section on education. As most people know, Sarah Lawrence was the first master's program in health advocacy, and they paused their program, but great news, they are actively searching for a new director for this program. And so that's kind of interesting in context with Assumption University. And you may or may not know, but Assumption used to be Assumption College, and in the last year actually earned university accreditation status. And so they have had a master's in, they do have a master's in health advocacy program. And consistent with this new accreditation, they're also taking a look at this program. So they have currently paused new applications, but all enrolled students will matriculate when requirements for graduation are complete. And we've had a lot of really great discussions with Assumption, their sponsor, and also we're working very closely in partnership with them to focus on how to make sure that the master students have really good, robust practicums. And so that will continue to be. So if you are an organization that can host a robust practicum for those master's level health advocate students, we'll have about 9 opportunities in the next year and a half. And please, give a shout out, contact us at info@healthadvocatex.org, and we'd love to talk with you. You'll hear more about that. And this conference this year also has some very special sessions on Saturday targeted towards students. So if you're a student tuning in, we have 2 sessions not to miss. And one of them is about setting up a practicum, and then the other one is highlighting the experiences from successful advocates and what's been their path. Okay, so now I'd like to just review what's been happening at Health Advocate X. So last year at this time, we were still the Washington State Health Advocacy Association. We were stepping into our role as Health Advocate X. So since that time, we have launched as a national organization, and our vision is that individuals are actively involved, fully understand, and can make their wishes known to choose the care that they want. And our mission is to transform people into active participants in their care. And we do this by educating, connecting, and inspiring people to include advocacy into all aspects of health and healthcare. So that's what we're about. And here are the people behind making that happen. And a lot of them are on site here today. You're going to get to meet them. They're going to do a quick hello pop in for the people that are here in person. But very grateful to our executive board, including my great partner, Beth Droppert, who many of you know, who's been very vital in founding this organization and advancing it. Bonnie Bazell, Kristen Tellini, and Gina Colbert, who serve on the executive board. And then we have Greg Berkman, who's served on the executive committee. Actually, he's sitting right over there. Thank you, Greg. And we're going to hear from Dale Reisner tomorrow. She's accepting our first ever Health Advocate XX Award at our kickoff session. And we have Ashley, who's behind the scenes making it all happen. If you have a question, it's likely going to be answered by Ashley. Jenny Perez and Sarah Morton, who've been really helpful, especially on inquiries. And then we have our wonderful, amazing advocate springboard. So practicing advocates who help us actually steer our organization and make sure things are relevant for you. So Anne Llewellyn, Io Doka, and Diane Savastano, very appreciative to them. They're at the conference. You'll hear from them in different sessions. But we couldn't be doing all of this without the help of all of these people. So we like to say that we're leaders, innovators, and collaborators. We are a 501c3 nonprofit organization, meaning that we serve the public, and we're a community of 1,800 people. We're growing. We've grown about 200 people since last year and doubled our membership, which includes partner, professional, and supporter members. So we do these three things. We educate people, we help them build skills, and we create connection. And we do that through, on the education front, through events like this, public presentations, through our community conversations, and social media. And our skill building is really focused on workshops, webinars, networking, case review. And we do have a Train the Trainer program where we license presentations that have been pre-vetted and have been pre-tested to advocates to give to the public. And I'll talk in a moment more about that. And lastly, but not least, is we do have a directory, we have educators, we put on resource guides, generally in connection with our events. And we have an inquiry program, which I'm going to talk about in a minute, as well as a volunteer program. So we've been very fortunate to have been able to step into providing a lot of unique events with the pandemic. One of the key areas we have really done that in is a program that we call Community Conversations. And so Community Conversations started May 30th. Seattle was ground zero for the early COVID. And so we found that people were really casting about for credible, actionable, timely information about COVID-19. And so we're very fortunate to have Dale Reisner, who's a doctor and medical director at Swedish Health Services in OBGYN quality and safety, who really has a pulse on a lot of the COVID statistics. And she's great at translating that. So we began our community conversations in March. and started them weekly with different guests coming in on a wide variety of topics. Those are actually still posted to YouTube. They're free and available to the public. And I have changed them to be monthly conversations. And so our next community conversation, actually, it's on our website, is November the 15th, which is a week from Monday. We usually do them the second Monday, but we thought everybody needed a break, so we're doing it the third Monday this month. And we're having a special speaker who's going to be talking about burnout and healthcare. So you'll want to tune in for that. We also have programs like this live virtual screening of a film called This Might Hurt, and hosted webinars like Health Literacy, the New Vital Sign. And in fact, Sue McWilliams, who she still has the Health Literacy, the New Vital Sign webinar. It's still up on our website, but she also did one of the Anytime sessions called Moral Distress and Compassion Fatigue, and it was really terrific. So she should be attending this conference too, so you may want to reach out and thank her for all the good work she's been doing. So in the last 2 years, over 3,000 people have attended our events, and so it's been really fun to be connected with so many people. So you may not be familiar with one of our cornerstone programs, which is overseen by Beth Droppert, which is our inquiry program. And so we get questions from the public on all kinds of things related to health advocacy: how to find a health advocate, how to navigate insurance, where to go for long-term care, medical billing. This is a key way that we respond to the public, and as you can see, our inquiries have increased over time, and over the span of the time that we have been founded, we've served over 1,000 people, and that continues to increase. So if you want more information about that, contact Beth Droppert. She's actually at our booth, so you can send questions through the booth or through the app. So if you want to be involved, we'd love to have you join our team in some way. Here are some very specific ways you can get involved. One is we do have a speaker program with two vetted presentations. One is called Taming the Medicine Cabinet, and one is called The ABCs of an Effective Doctor Visit. If you're interested to potentially license these presentations, you can contact us at info@healthadvocatex.org. We're also looking for national board members. We currently have a board of about 12 people, and we're looking to expand that. So if you're interested in getting involved in leadership, we're looking for people outside of Washington State with diverse backgrounds. You don't have to be a practicing advocate to join our board. In fact, we have a lot of non-practicing advocates and other professionals who are currently on our board. We are also looking for guest moderators, facilitators, and hosts to do things like our community conversations and some of our other events. So if you might be interested in doing that, please let us know and drop us a line. The other thing is that we would ask that you consider donating to support additional staffing for our organization as we've been growing. So make sure that you sign up with us. We have a free community membership, we have a supporter member, we have professional membership, and for organizations, partner members, we would welcome you. So we wanted to mention a couple other organizations to make sure to keep your eye on that you'll definitely want to know about. They're also at the conference. So one thing that should definitely be on your radar is the International Conference on Patient Advocacy, Icopa, in 2022. I'm planning on being there. I hope you will too. The conference sign-up page is now live, and that date is April 28th through 30th in Chicago. So hopefully it will be, it's going to be in person. Can you believe it? I would love to see you there. And Icopa has also put together kind of a cool compilation of videos of advocates from all over the world. So highly recommend you check that out. It's super cool. So other organizations, we just wanted to highlight the Care Partner Project. You may remember Campaign Zero, headed by Karen Curtis out of Chicago, is a great organization that has a wonderful presentation called Safe and Sound in the Hospital that I've been giving since I think 2009. Highly recommend that. They are now the Care Partner Project. Karen Curtis is here. She's a sponsor and has a booth. I also wanted to point out that they have something really cool called the Advocacy Fund. So for their vetted speakers, they have grants that can support part of the cost of serving folks that cannot afford to pay full freight for an advocate. So I highly recommend you ask Karen about that and check out her organization. And I'd also like to do a shout out to Aileen Karina and her organization called Pulse, which is a Center for Patient Safety and Education and Advocacy. You may have been familiar with that campaign, Take Charge. There are so many things, resources, and campaigns that are available through her organization. She's very active on the community chat board in Hoover, and there are a lot of people with that organization here, so check them out. So last is just a call to collaborate. I think we all know that we're all in this together, and each of us doing a part, working together. There's no reason why we all have to be kind of overlapping doing the same things. So the idea is, how can we work together to help support and grow this field? So a couple things to point out for you to know about is we're partnering with Knack on an upcoming webinar called Dynamic Healing, Addressing the Root Cause of Chronic Diseases with David Hanscom. You might remember him. He participated in our conference 2 conferences ago. Anyway, he's giving a webinar on this dynamic healing idea, and it's free for our members, Knack members, and there are also CEs attached. So check that event out and register either at Knack or also on Health Advocate X. And we're also putting together a member survey that will be a combined survey with Knack and GNA and anyone else who wants to participate. But the idea is to start gathering as much information and data as possible among all the organizations and all the people that are practicing health advocacy out there. So I hope you'll kind of watch out for that and participate. So last but not least, there are a lot of different ways to find advocates. And I don't know about you, but when we get a request, we go and search all of the directories and see, who's doing what. So we all need to be working together on this. And so it's an opportunity for us to kind of take a look at what we're all doing and seeing where we can all be providing kind of a consistent experience to the public, because I think that's going to make everybody better and bigger. So with that, I would like to thank our sponsors. Thank you so much, presenting sponsor, Greater National Advocates. We're grateful to Pathway sponsor, Assumption University. Our networking CE sponsor, the Patient Advocate Certification Board. The mentor sponsors, Bannister Advisors and My Care Alliance. They both have sessions on Saturday that you won't want to miss. Our happy hour Let's Chat sponsor, Knack. And our amplifier sponsors, just looking at that, it's ERA Living, and actually Pinnacle Care should be on that. So thank you, Pinnacle. and would also like to thank our partner members. So these are organizations that work and or support the field of health advocacy. And we're grateful for all of our partners to help support the organization, be able to bring this conference to you. And with that, I would like to end the show and open it up for questions. And I have to say, is Ashley nearby? Or somebody who can see the questions? Okay. So let me, so what questions do you have? Anyone? Do we have questions? We have chat.
So Robin Lori Clemens asks, do you see a day when we'll be able to be providers eligible for health insurance reimbursement?
So hang on one second. Yes, okay, thanks. So, there are some people that would argue they don't want reimbursement, but I think reimbursement is personally a great idea because I think then advocacy services will be scalable. And yeah, I do think that there will be reimbursement in the future. And when you look at reimbursement, especially for telehealth services, for end-of-life counseling, I think some doula services are reimbursed. I think it's very akin to what advocates do. So yeah, thank you for that question, Lori. And thanks for reading them, Greg. What else do we have here?
Let's see here, some comments as well, but we'll see responses there. So keep those questions coming.
So somebody asked Robin Gerhardt if Icopa can be virtual. I don't know if there will be any virtual aspects to Icopa, but it's kind of an interesting question to pose. Anne Llewellyn and I think Terry Dreyer are here. And Tricia too. Those are the three folks that are putting the conference on. So you may want to ask them that. And somebody also responded that some long-term care plans already do reimburse for advocacy services. That's right, I forgot about that. So thank you for, Adrian, for mentioning that.
So Irene and actually Mark is following up. Why are there 134 people here and 75 attendees on the app? I suspect it's because some of us are on the web page.
So 75 is, I think, the people that pre-registered to sign up for the session. So if you click on the session to add to your agenda, that might be what you're seeing. But I know that we had 270 people sign up as attendees for the conference, so that might be it.
I think another interesting question that we have earlier in the chat is from Ray. And she asked, do individuals with an RN, MD, or PhD really need this credential? And I figure with this credential, we're talking about as a professional health advocate.
The BCPA.
Yes, correct.
So yeah, thank you for that question. And I think that's a great question to be answered in session 2, which is coming up shortly here in about 20 minutes. So let's ask that of Melissa and Danielle.
Looks like another one here from Nicole Rochester. Has there been any discussion about banding together to purchase health insurance benefits as an association? The cost of purchasing health insurance in the open market can be exorbitant for advocates.
Yeah, I think that's a great point. And really the appropriate organization to do that would either be a private organization like My Care Alliance, you may want to ask that of My Care Alliance, or a professional association, a 501c6 professional trade association for health advocates, which is desperately needed. Okay. Well, I think that was the last question because we are right at time. Thank you so much for your attention today. It was great to see you virtually. I wish it were in person, but hopefully we'll see you at the Icopa conference. And we will see you for session 2. Remember that in order to get your CE, you have to attend live and you have to pre-register. So click on that session overview and go to the registration link, and I'll see you there in about 15 minutes.